Hello, everybody. It's Rachel with Healthy Means Fitness again, and with this channel, my goal is to be constantly posting things that are related to health and wellness, mind, body, and soul. And I've wanted to do a video series on the pandemic that we've been experiencing because it's so health related, physically and mentally, right? So I didn't want to do these videos while the election year was still going. I mean, this was so intricately linked politically for so many people that I really wanted to wait until the election was pretty much over before I put out a video, because I didn't want anybody to confuse it and think that this was some sort of like political stunt, right? So what I want to do is focus on three terms. In this video, we're going to focus on three terms that you may or may not understand the difference between: coronavirus, SARS-CoV-2, and COVID-19. All three of these things are different things. That is right. All three are different things. And if you didn't know that, and that's kind of shocking you, then that's just another example of the media not really doing its job. Quite frankly, the media has done a piss poor job of educating people about this virus. And what that has led to is a lot of unnecessary fear. There is something to be said for necessary fear, okay? To be cautious and prudent of anything new in our world is smart. That's a wise thing, all right? Unnecessary fear, panic, hoarding things from the grocery store, all this kind of stuff is just completely unnecessary, all right? So let's dive into the three differences. First, we're going to start with coronavirus. Coronaviruses are a family of viruses. So when you think about viruses in general, they exist in families, sort of like the mob, all right? So I think of viruses like the mob. And you've got your families, your mob families, and like you got your Corleones, and then you got like whoever the Italians are that the Corleones are like against, all right? So you got mob families, and if you take a very simple family of viruses, influenza, and you break it down, everyone's heard of influenza, and you break it down, you have subcategories. So you have influenza as the family, then you have subtypes, influenza A, influenza B, and then within those subtypes, you have specific viral strains that fall within those categories. So everybody's heard of H1N1, so we're just going to use that because everyone's heard of it. H1N1 falls under influenza A. So it's the specific viral strain under the subtype of influenza A within the influenza family. All right. And by the way, H1N1 was basically a resurgence of the Spanish flu. I don't know if you realize that, but this horrifically deadly flu from 1918 is H1N1. The Spanish flu is H1N1. You can look it up. I'm going to have a ton of links below that you can check out if you want. I found that really, really fascinating. And of course, it acted exactly the same. So we'll go into that a little bit later because I think that's kind of fascinating. But let's move over to the coronavirus family, all right? So now you got your other mob family, your coronavirus family. And within that coronavirus family, you also have subtypes. You have like MERS, SARS. These are subtypes. SARS is severe acute respiratory syndrome. MERS is Middle Eastern Respiratory Syndrome, far more deadly than SARS. Okay, far more deadly, not even exaggeration there. But you have SARS, Severe Acute Respiratory Syndrome. And then this viral strain that we've been dealing with this year is SARS-CoV-2. And the CoV is short for coronavirus. COV is short for coronavirus, all right? Like FLU is short for influenza. So SARS-CoV-2. And there's a reason there's a 2 at the end. We already had a SARS-CoV outbreak in 2003. Bet you didn't know that. It went around the world, infected people, and killed people. It was the original SARS virus, SARS-CoV, all All right, so since there was already an original, and this one that we're dealing with is like 85 to 90% identical, there's a 10 to 15% variance. It's a little mutation in the strain. It now has to be called number 2. So coronaviruses are around us all the time. This family of viruses is everywhere. There are hundreds of strains of coronaviruses at any given time around us, everywhere we go. Actually, I think they said about just 4 strains are responsible for about a third of all common colds that we get annually. So if you've ever had a cold in your life, a common cold, chances are you've had a coronavirus and you didn't know it. So coronavirus is not a term that should be fearful all by itself. It's just a family of viruses. And you've probably already had them in your life, especially if you've already had colds. It's just that there are subtypes, and this subtype SARS, we had the first wave of SARS-CoV go around the world in 2003. Again, a lot of people were infected. There were definitely thousands of people who died. The numbers were not what we're projecting the numbers this year to be. It probably won't be another decade or so before we actually know the validity of the numbers that we're hearing at this time for the virus. But suffice it to say, this virus that we've been dealing with, SARS-CoV-2, this is the actual virus. This is the strain. This is what you can actually catch, okay? It's the specific strain under the subtype SARS in the family coronavirus, all right? That is what you're getting tested for. When you get tested, you're getting tested for SARS-CoV-2, not COVID-19. And that's something we're going to get into because I am really frustrated personally with hearing all the testing being COVID labeled when that's not what you're getting tested for, okay? So you're getting tested for the virus. And it doesn't matter if you're doing the antigen test or the PCR test, they're testing for coronavirus. They're testing for this SARS-CoV-2 strain, all right? Now, let's move over to COVID-19. COVID-19 is a disease process that some people's bodies may or may not develop in response to the virus. The virus is what you can contract. It's what you can transmit. That's what you can test for. COVID-19 is not catchable, it is not transmittable, and you cannot be tested for it. You can be diagnosed with it by a medical professional, but it takes a doctor to analyze your symptoms to determine that what you are experiencing is the disease process COVID. If you're one of these people who thinks, I think I might have had this virus last year or like earlier this year before I even knew what it was kind of just this really severe cold, and like then I was kind of over it, but it kind of kicked my butt more than usual. I think I kind of had it, but I'm not sure. If you're one of those people, chances are you may have had the virus, but you never had COVID. COVID is the disease process that some people's bodies may get in response to the virus if their immune system is compromised or suppressed enough that their body experiences dis-ease. Disease. A lot of people have already heard that breakdown. For those of you who haven't, that is what disease is within our body. It's dis-ease. And the majority of times, disease derives from a suppressed or compromised immune system. Your immune system's not doing its job properly. It's a fascinating system when it's working well, but when things have taxed it or suppressed it, and i.e. that would be the American lifestyle on average, all right? We'll go into a little bit of that. Then the chance that you're going to have disease within your body is very great. And in relation to the whole, as far as how many people have contracted this virus, the portion of people who have actually expressed disease because of the virus is relatively small. And then even smaller is the population of people who have had an autoimmune response that has created a cytokine storm, a protein storm within their body that causes that is part of their body attacking itself, okay? When you have an autoimmune response, your immune system goes haywire and it starts attacking your own healthy body and breaking your own healthy body down. on accident. It's not doing it on purpose. But instead of attacking the invading force, it starts malfunctioning, miswiring, and attacking your own body. And that has been a major player in what has killed people from this virus. All right, their own immune system going haywire. So it's not to say that this virus isn't real. Of course it's real. It's not to say that this virus is not dangerous. It can be. But the majority of people are going to catch this virus, not even know they had it. Their immune system is going to do its job, and they're going to sail right through it. There is a portion of the population who are going to experience dis-ease within their body, disease, symptoms, because this virus triggered, their immune system just can't handle what is going on. And so their body expresses more symptoms, more severe symptoms than another person, and that is called COVID. And an even smaller portion of people are going to have an autoimmune response that lands them in ICU and kills them. And I also want to make it very clear that this virus is a viral pneumonia. It's expressing itself as a viral pneumonia. And viral pneumonia and bacterial pneumonia are always scary and always dangerous, always. In the health field, especially in therapy with elderly, that's where I work. I work specifically with the geriatric population. When one of our patients falls and breaks a hip, okay, and we hear that they went to the hospital over the weekend, we are almost never concerned about the broken hip. We're almost never concerned about them coming out of anesthesia from the surgery. We're almost never concerned about them contracting an infection, okay? The majority of the time, even though those things are concerns as well, the majority of time, the overwhelming concern is they're going to spend many days in the hospital because of the surgery. And the chance that they develop pneumonia is very high. And if they do, the chance that they die is very high. Pneumonia is no joke. And it doesn't matter if it's viral or bacteria, it's no joke. The majority of people who died when H1N1, that flu, the Spanish flu resurgence, came around in 2009, died because their body contracted pneumonia. That flu became pneumatic in their system. They developed viral pneumonia from it. And they wound up dying because the body has a very, very, very hard time dealing with pneumonia of any kind. If you go to the American Lung Association website, I'll put a link down below. If you go to that website, you'll see that they have the annual data for flu and pneumonia deaths in the United States, and they have the annual data for about 10 to 15 years at a time. And if you go through and add up and divide and get the average flu deaths and the average pneumonia deaths, pneumonia is 30 times more deadly than the flu on average. That's just simple math. It is that severe. Pneumonia always has the potential to leave lasting effects, permanent lung damage, cardiovascular effects. The chance that you're going to have a heart attack after experiencing pneumonia exponentially goes up. The chance that you will die within 10 years of getting pneumonia exponentially increases. Renal failure, other organ failure. So many things are related to pneumonia. These are things we know of pneumonia. We've always known them of pneumonia. They're being talked about with COVID as if there's something so much worse and so much more severe than what we already know of traditional pneumonia. But all of the things that have been presenting with COVID, the organ system failure, the potential for heart attack, the potential for long-term lasting lung damage, the potential for renal failure, so many of these things are identical to pneumonia possibilities. All right? So I think it's really important to understand that, because if you've never actually been taught about pneumonia, and you've never been taught about how severe it can be and what the concerns are and the lasting effects can be, then it makes SARS-CoV-2 sound like it's like the worst thing that's ever hit humanity. I mean, is it worse than a flu? Yeah, but all pneumonia is worse than a flu. all pneumonia, according to the American Lung Association, is about 30 times more deadly than a flu. So of course there's something to be said for the fact that this is potentially dangerous for people. All right. And I don't want to sit here and act as though this doesn't have an effect on people's health. It absolutely can have an effect on people's health, especially when their immune system is compromised. And the majority of people who have passed away from this virus have had 2 or 3 or more pre-existing conditions that were already suppressing and overloading their immune system. And this was literally the straw that broke the camel's back. The immune system couldn't handle it anymore. Everybody's immune system is working for them every minute, every second of every day, and you don't even know that it's doing its job. And you are potentially suppressing your immune system through your lifestyle all the time. You might be chronically suppressing it and not even know, which puts you at a higher likelihood of developing a disease process when a new virus hits your system. But I want it to be very clear that COVID-19 is the disease process that may or may not develop as a result of the virus. And you've heard things like this before, because herpes is a virus, chickenpox is a virus, and later in life it can express itself as shingles. So you have a virus that's in your system that doesn't do anything the majority of the time, your body's fine. When you have an immune suppressed or immunocompromised moment, boom, it can spring up as shingles, and that is the disease process. All right? Same thing with HIV and AIDS. HIV is the virus, AIDS is the disease process. And some people may or may not experience disease when they have contracted HIV. Some people will contract HIV and never experience AIDS their whole life. The chance that you experience AIDS goes up exponentially when your immune system is compromised in any kind of way. So disease processes cannot be transmitted, they cannot be contracted, they cannot be tested for. Disease processes have to be diagnosed by a physician. So when people are saying you're getting COVID tested, I actually really hate this phrase, because you're not getting COVID tested. You're getting SARS-CoV-2 tested. You're getting SARS tested or coronavirus tested. You're not getting COVID tested. COVID is a disease process. And the minority of people who contract this virus are actually going to express disease. And an even smaller portion are going to have an autoimmune response that winds up killing them. Okay? Autoimmune processes are just your body's immune system going haywire and attacking your own system. And it's always dangerous. So I hope that this has given you a little bit of education. I want to go into so many more things, but I'm thinking maybe I should just leave it at that and then go into other things in different videos, because there's so much to cover, including little tidbits that I already went over, number comparisons between the H1N1 resurgence, the Spanish flu resurgence that we had in 2009 around the world. It literally infected 1 billion people in the first year. And with SARS-CoV-2, it's only 52 million have been affected, and we're over a year into this already. So 1 billion versus 52 million is strikingly different as far as contagion ability. And there are a lot of other factors that I think are fascinating to compare, because clearly they're not the same. They're two different mob families. One is the flu family, one is the coronavirus family. But within those two mob families, the expressions of these, it's pretty fascinating, the differences in the numbers. And then I also want to touch on in the next video the fact that SARS-CoV has already gone around. We already had a first wave in 2003, and we have been studying it for 17 years, and we have been attempting to find a safe and effective vaccine for the first SARS for 17 years with no success. This virus is SARS-CoV-2, number 2. This is the 10 to 15% mutated strain. And I want to leave you with this thought. According to medical experts, they've been saying that 10 to 15% mutation is so clinically significant that we know nothing about this virus. It's unknown. We don't know anything. So they're saying that 10%, that 10 to 15% is so significant. But yet they're saying that after 17 years of not being able to find a safe and effective vaccine for the first SARS, within 8 months to a year, we're gonna have a vaccine for this SARS-CoV-2 that's so clinically different, we don't know anything about it. I'm gonna just leave that with you to kind of let that marinate for you, because the main purpose of this video was definitely to break down the 3 different terms. Hopefully you understand them a little bit better. Coronavirus is just a mob family. It's just what kind of virus is it? And there are hundreds of them around all the time. You've probably had them before in your life if you've had colds. There are subtypes, MERS and SARS. Under SARS is SARS-CoV-2 and SARS-CoV, the first one. Specific strains of a subtype of a family. And COVID-19 is over here as a disease process that may or may not ever develop in someone's system. And most often will develop if that person has a compromised or suppressed immune system. And it is exceedingly easy to suppress your immune system. Even a 16-ounce can of soda that has 52 grams of sugar will suppress your immune system for 4 hours. Think about how much sugar you take in a day. Sugar alone suppresses your immune system. Stress suppresses your immune system. How many people in America do you know live a stressed lifestyle? How many people in America do you know are addicted to sugar or eat an extraordinary amount of sugar in their daily diet? How about you? How many people manage their stress through sugary foods or alcohol? Each one of those things is systematically, chronically suppressing your immune system. And that puts you at a much higher likelihood of contracting a virus. When you do contract it, it puts you at a greater risk of developing a disease process rather than having your immune system take care of it right from the start. So I'm gonna do a couple more videos, immune system video, SARS-CoV versus SARS-CoV-2 video, H1N1 versus SARS-CoV-2 video, because I think it's really fascinating. And hopefully you enjoy them. Hopefully you enjoyed this one. And hopefully this has given you and armed you with some information that you can take forward, educate people on at your leisure, and allows you to hear different articles, news reports, whatever, and know when these terms are being used improperly. You're gonna hear them used improperly all over the place. And that, to me, is a strikingly shocking and sad but important thing to notice going forward with what you feel you can or cannot trust that you're hearing. Okay? Check the links below if you're interested in the science. Comment if you want. Subscribe if you want to be pinged on the next videos. Love and health. Take care of yourself and your loved ones.